Michelle is a doctoral student obtaining her doctorate from North Central University in California. She is pursuing a doctorate in organizational leadership. Michelle is conducting an applied research study that focuses on health disparities in minority populations. She hopes to add to the body of knowledge concerning this research topic. Michelle's speech is 5 to 7 minutes, and her title is The Impact of Cultural Competency on Healthcare Leadership Efficacy in Diverse Patient Populations, a Quantitative Study. Please help me welcome Michelle.
Good morning, Madam Toastmaster and fellow Toastmasters. I'm going to provide you with a glimpse of my doctoral dissertation. Let me share my screen. Okay, sorry. This is my title page, The Impact of Cultural Competency on Healthcare Leadership, Efficacy in Diverse Patient Populations. My research is a quantitative study. And what quantitative means is, well, there's two types of research. One is qualitative and one is quantitative. Qualitative is with words, and quantitative is with words and numbers, which involves statistical analysis. Applied research. There's also two types of research. It's applied and it's pure research. Pure research, what pure research does, it expands the body of knowledge on a particular subject or topic. Applied research is when a researcher conducts a study which solves a real world problem. For me, the real world problem is health disparities in minority populations. Recently, well, during the pandemic, especially in the beginning of the pandemic, there were a number of minorities who had died as a result of COVID. And it was indicated that, or shown that more minorities died than non-minorities. So this is a topic that has been in the news, and it's a topic that I wanted to pursue, or subject that I wanted to pursue. The purpose of my study is to determine in what manner cultural competency impacts, to determine in what manner an educational intervention impacts cultural competency for medical professionals. Problem statement. The problem statement in my dissertation is, the problem to be addressed in my proposed study is that hospital staff or medical professionals are not receiving adequate training in cultural competence in the US. The theoretical framework for my study is based on the theory of cultural competency proposed by Cross et al. In parentheses 1981. I'm sorry, 89. The theory of cultural competence is a principal approach centered on the actions, ideals, and guidelines in an organization or system that are interconnected and used to develop the skills and effectiveness within a multicultural environment. My citation may or may not be correct, only because the APA edition that we've been using for many years, which is APA 6th edition, has now changed to the 7th edition. Hopefully I revised that. My research question is, I have one research question. And my research question is to what extent is there a difference in the pre-test and post-test cultural competence scores of medical staff following an educational intervention? There are two hypotheses, and which is a ho and a ha. The ho is the null hypothesis, and it's the one that's shown to be correct unless is proven to be incorrect. And then there's the ha hypothesis, which is the opposite. I'm going to be collecting data and using a pre-test and a post-test. And the pre-test is going to be the same as the post-test. In between, I'm going to be using a educational intervention, and I'm going to measure the results of the pre-test and the post-test. The population of my study will consist of participants from the state of Colorado and Pennsylvania. The gender are male and females. Their level of education will range from bachelor's, master's, and doctoral degree, and their age will be over the age of 18. The sample size of my study will be 27 hospital staff members. And their position, and I will be using a G-Power a priori power analysis, well, to calculate the significance, effect, and the power to attain the sample size. In other words, after conducting a G-Power a priori, it told me that I would be able to, the least amount of people that I could use would be 27 people in order to obtain the results needed. And because we're somewhat in the middle of a pandemic, 27 hospital staff employees is good, considering the amount of time it's going to take them to not conduct, but to do the pre-test, the educational intervention, and the post-test. And there are no incentives being given, so I am so grateful for just being able to obtain that amount of people. I'm going to be using, my data will be analyzed using a pair t-test supported by the use of Qualtrics data analysis software. So I'm gonna collect my data and then use that Qualtrics data analysis software in order to obtain my statistical results. My data will be collected using a survey as well as an educational intervention, and I will be using the same survey for the post-test as well as the pre-test as well as the post-test. And my participants will consist of physicians, physician assistants, nurses, and nurse practitioners. And these are my references. And I will be concluding my speech and turning it back over to Madam Toastmaster.